and everybody else. Thank you for joining and for finding the time to participate in this event today. This is the meeting of the European Parliament Interest Group on Innovation in Social Care, which Health First Europe has supported since 2014. Thank you particularly to MEP István Way, who's kindly agreed to host the meeting and to provide some opening remarks, and to our speakers, including Maya Matthews from the European Commission, Unit for Health and Food Safety, Dorota Tomalak, Deputy Head of Unit in the Committee of the Regions in the Secretariat of the Commission for Natural Resources, Sabina Pasch-Olsen from UVECA, George Valiotis, Executive Director of the Health Management Association, EHMA, and Annette Ruzanov, Director of Policy and Programs, also at EHMA. So I sincerely thank all the panelists who've contributed to the report as well as to today's event. So and we've seen that there's quite a good turnout for this meeting, which is really encouraging, because we know that this is an important topic as we continue to witness and live through the consequences of the biggest health crisis of most of our lives. Before we start, I'd just like to give some brief housekeeping rules. I think you're all experts on virtual meetings by now, so it's just a kind reminder, this meeting is being recorded to make it easier for us to capture everyone's contributions into a short report afterwards. We're not planning a tour de table, but I would ask each participant who does ask a question later to introduce themselves when they ask the question. And because there were more than 100 of us registered, it'd be great if you could stay on mute while our speakers are speaking to avoid interruptions, and use the chat window or the raise hand function to let us know if you'd like to ask a question, so we can try to manage that when the time comes. So after that housekeeping, I'll just give a short introduction before passing the microphone to MEP Way. So for more than 15 years, Health First Europe has evangelized the public health benefits of screening and early diagnosis as key enablers for saving and improving lives, of the integration of care as a means of delivering innovative healthcare to all European citizens, and of the importance of education and training in creating more effective and resilient healthcare systems. These concepts have also recently been echoed in reports from the European Care Strategy to ensure quality, affordable, and accessible care throughout the Union, and in the new WHO report on policy options to help stabilize and strengthen the health and care workforce in Europe. Educating healthcare professionals may sound obvious, but this can contribute to preparing them to better respond efficiently to patients' needs and equipping them to perform their duties. But before fostering a new approach to education and training and promoting the acquisition of new skills, we need to identify the challenges we're facing in detail and pivotal skill areas to deliver better, more resilient, sustainable, and effective person-centered care. So after the COVID pandemic, the European Commission presented a reviewed version of the European Skills Agenda built on the 2016 plan for people to develop the right skills and strengthen a resilient potential crises. Today, with this new report, the European Policy Platform Stakeholder Network wants to help keep the momentum and continue the work we started on improving the education of the healthcare workforce by identifying the required skills for a more efficient and resilient future healthcare workforce. So this meeting and the report serve as a call to action to European, national, and regional policymakers to apply our recommendations and create the conditions for top-down measures to improve and prioritize healthcare workforce education and training. I highly encourage you to read the report and to disseminate it throughout your networks. Without further ado, I will now hand the floor to MEP István Way, our host, who's kindly agreed to provide some opening remarks.
Thank you so much, Brandon. It's my pleasure to be here, dear ladies and gentlemen, Laura, Annette, and all my good friends, and can I say that relatives in the big European healthcare family. Thank you so much for your invitation. European healthcare organizations are here. So dear colleagues from the European institutions, I really would like to thank all of you who have taken the time to come online and take part in such an essential discussion. Of course, it is an honor for me to be here with you today, as I am a politician who is highly committed to improve healthcare in Europe. My name is István Újhelyi. I'm member of the ENVI committee. In the same time, I'm first vice chair of the Transportation and Tourism Committee. But which is more interesting, I'm one of the initiators of the European Health Union project. That's why I think I'm your host today. You have to know that both my parents were doctors. Thus, it has always been a part of my life. And furthermore, I have experienced and seen the healthcare situation in my own country. The past few years, especially the COVID-19 pandemic, have shown us how important it is to have accessible, quality healthcare in every country, all the European countries. Hence, the launch of the European Health Union was a crucial step in moving forward with the provision of a wider and better healthcare in the member states. Everywhere in the member states, I would like to underline that. With the help of the EU for Health program and its 5.3 billion euro budget, it is and it will be a huge help in achieving the desired resilience of healthcare systems. I do believe that the HERA, the European Health Emergency Preparedness and Response Authority, will provide more access and availability of the needed measure in case of cross-border health threats, which is another column in achieving our goals. Thankfully, we have many interest groups, alliances, and organizations who focus on this matter at a high level and provide us with ideas, studies, and initiatives in order to develop our healthcare systems in the best possible ways. Now, I would like to highlight those entities without whom today's event could not have happened. I would like to thank you for Health First Europe, an alliance that does everything to ensure patient safety, protect patient rights, and create high quality and sustainable public healthcare systems in Europe. They are the ones who invited me to be the co-chair of the European Parliament Interest Group on Innovation in Health and Social Care, in which we aim to improve patient access to access on innovation in health and social. Access to innovation in social and healthcare by influencing EU policy. I would also like to highlight the work of the European Health Management Association and their effort on improving the capability and capacity of health management. These associations dedicated their time and effort to research on why and how we should strengthen the resilience and skills of the future health workforce in Europe. Today, we can see one of the results of their hard work by attending this event and reading their report on the essential skills for a resilient and effective European health workforce. COVID-19 has not only put a strain on European healthcare workers, but it has also shown that there is a lack of skills among healthcare professionals to be addressed. During the pandemic, it quickly became obvious how the healthcare workforce had a central role in responding to this crisis. Therefore, a health workforce with the right skills is essential to build a system ready to face any type of challenges that we might face in the 21st century. Today, we live in a dynamic world, and we encounter with constantly changing trends and challenges. This is one of the reasons why this report has high importance. They display the already existing and foreseeable skills gaps in our health workforce that we really need to take into account. I'm a supporter of the integration of digital competencies as they facilitate the access to our health documents and even the organization and attendance of the trainings for the workers could happen this way. Another, this is my opinion, very important statement of the report is the recognition of the need for more patient-centered communication. More engagement between the patients, nurses, and doctors could also bring beneficial effects on their mental health, not only their physical health. This report is absolutely in line with the European Parliament's work, which acknowledged during the previous legislative term the value of continuing professional development. This is why I want to highlight the importance of lifelong training to keep up with the changes and challenges ahead of us. We can all agree on the fact that it is clearly seen that the workforce in healthcare plays an extremely important role when it comes to preparedness and resilience. And we should not forget that a skilled healthcare workforce goes hand in hand with emergency preparedness. Should our doctors, nurses, carers, and other hospital staff have had the right training? I'm sure that our responses to COVID-19 would have been different. This is why one of the objectives of the European Health Union is to address the unequal distribution of health workforce capacities in Europe and support the regions struggling to attract health professionals. Yet the Union needs to promote training and education according to high quality standards that would be applied throughout all the member states' territories. Again, the importance of the European Health Union and its benefits for patients cannot be overlooked. And this is the message I intend to convey next week during the European Health Forum in Gastein. I would like to demonstrate another very important thing through an example, very concrete example. A patient in Hungary will most likely receive a lower standard healthcare service than they would, for instance, in Germany or, for example, there in Belgium, as we do not have the necessary equipment and infrastructure in every public institution to provide treatments at the same standards. In this summer, with my youngest son, he's 2 years old, unfortunately, we had to visit hospitals in Budapest, in Brussels, and in a countryside small hospital next to the Balaton Lake in Keszthely. Everywhere we had to stay 4 or 5 days. My wife had to stay together with my son. I can tell you what's the difference between Budapest and the small countryside city, or between the healthcare service in Budapest or in Brussels. And if we are talking about the European Union, it is terrible. We had to do something. I reckon that this kind of inequality in healthcare systems between the member states is untenable, and it needs to be tackled first so that we will be able to proceed to other important issues and developments, such as the profiling and training of the healthcare workforce. My logic behind this is when a country does not have the necessary resources and infrastructure to provide for quality healthcare, it is not likely that there are enough resources and possibilities for trainings of the workforce either. These suggestions and possible developments that are discussed today are essential for our goals. Strengthening the resilience of healthcare systems and providing an integrated approach for care can only happen through the implementation of minimum standards for healthcare services and with the help of the highly qualified healthcare workers in the systems. I will continue to support recognition of the education of the healthcare workforce and truly embrace the recommendations of the new publication. I also believe that the Commission's support is essential to implement the recommendations of this report, to develop a strategy with the objectives to recruit more health professionals with a gender inclusive perspective and encourage systematic reskilling and upskilling for the workforce. The role of regional, local politicians and policymakers, it is also key. And I'm happy because Dorota Tomalak is here with us representing the Committee of the Regions, because this is the dimension where the real actions take place and the real changes happen, which we can observe and measure. Finally, I believe we should better promote the use of good practices and experiences of the different European associations. As a member of the European Parliament, a passionate advocate for enhanced safety within the European healthcare systems, I call upon the member states to consider implementing the recommendations that will be presented today. I'm also inviting these authorities to get in touch with all panelists and the organizers to further discuss and align consensus and support. Before I finish my speech, let me say thank you to everybody once who contributed to the birth of this report, and big thank you to Laura and Annette for the excellent cooperation, and also to my excellent friend and colleague Zoltán, who is responsible in my staff for the European Health Union project. He is better than me. You can believe that he knows everything, he knows everybody, and 24 hours per day he's working on it. That's why I really need him to work together with me. So thank you for your attention and enjoy the discussion. I hope we can make a better and more healthier European Union for all of us. Thank you so much.
Thank you very much, MEP Weyer, for sharing your personal experience as well as the kind words about the report and your vision for the European Health Union. Without further ado, I would ask my colleague to start sharing the slides, and I will present the report or a summary of the report. So there are only 10 slides. I do encourage you to read the full report if you have time later, but here will be the high-level summary. So this is a report above all of the European Health Policy Platform Stakeholder Network on profiling and training the health workforce of the future. It's the result of essentially a year of work that I'll describe in the following slides. The title is Essential Skills, for a Resilient and Effective European Health Workforce. To manage not only the current crisis, but other crises that may soon come. The next slide. So the background of this was the output of the stakeholder network. So we did, and I'll describe it again in greater detail in the following slides, a literature review as well as a survey of members, as numerous workshops, and the final report was jointly drafted by Health First Europe and the European Health Management Association. The goal is to achieve concrete actions on the ground. Directly or indirectly, and to raise awareness of existing and foreseeable skills gaps for the health workforce in Europe. Next slide. So the structure of the report, just to give a quick overview in case you haven't seen it, as I mentioned, it starts with a literature review. So we surveyed the literature, and I'll give a bit more detail in the next slide, I believe, on just what we were looking for. This was then supplemented by desk research by the Health First Europe and the members of the stakeholder network. It's more than 30 organizations. The network's consensus on essential skills for a resilient and effective health workforce, and then recommendations to policymakers at all levels of government in Europe. So the literature review, as I said, was an attempt to identify answers to a bunch of questions. Here are some of them. What is the European policy context for shaping the health workforce skills in the future? Are there enough large-scale comprehensive data at European level about health workforce skills needs, or does that need to be addressed? What are the 21st century challenges, trends, targets identified that impact the health and care sector? What skills are essential for the health workforce to successfully overcome these challenges and follow the new trends? And are there good practices which have been collected and shared on upskilling and reskilling the health workforce that we could then try to evangelize to a larger audience? Are there recommendations to be drawn from these practices? Next slide. So the findings included, first of all, the European policy context. It's clear that we have identified a skills gap in mismatches. There is a battle for talent. We've mentioned already the European skills agenda and the European, EU4Health work program, which has a twin focus on digital and green skills and training. We've identified that there are up-to-date, large-scale data missing on the health workforce needs of the future. So we have anecdotal evidence, we have some country-level evidence, but there is not sufficient data at the European level for exactly what the gaps are. We've identified challenges, including demographic change, an aging population, growing incidence of non-communicable diseases, chronic diseases, and multimorbidity, workforce shortages, particularly among nurses, the green and digital transitions, and changing relationships between patients and healthcare workers. We've identified essential skills that we believe to be missing. At least they're present in some pockets of the EU, but as Isfan was just describing, not necessarily at the same level throughout the Union. Digital, soft, and green skills to face 21st century challenges. And we've identified some good practices and recommendations for performance improvement, top down as well as bottom up, regular monitoring and feedback, and some task shifting. So we grouped these recommendations and the essential skills that we identified was into 4 clusters. One is digital and AI skills, because that is something which we know is important both to the Commission and to the member states, is keeping Europe up to speed on digital skills. AI is already present and will become more present in the coming years. But digital is not everything. It needs to go hand in hand with patient-centered communication skills, interdisciplinary and coordination skills. The fact that it's mentioned already suggests that it's not sufficiently taught in the education programs in Europe today, as well as green skills and climate education in order to help people in the health workforce make better informed decisions. So the recommendations fall into several categories. First, some general recommendations at the European as well as the regional levels. This was not necessarily within the scope of this report in terms of health workforce skills and training, but we did identify an urgent need for Europe to develop a strategy for health workforce retention and recruitment. There's no point piling more education and training on people when you've already got a workforce which is declining in some parts. We need to invest in large-scale, comprehensive, reliable data collection in order to make better informed decisions. We need to develop a strategy for systematic reskilling and upskilling at all levels, European, national, and regional. We need to prioritize education and training in political agendas. And we need to apply participatory approaches and engage the health workforce in developing education and training programs. So on the digital and AI front, these are not necessarily all of the recommendations. We've tried to summarize what we could reasonably fit on one slide. So again, I would encourage people to go back and look at the calls to action at the end of the report. establish a pan-European digital academies and develop model courses. Of course, health competence is primarily, the implementation is at the national level, but the EU can do a lot with some of the funds that are available under the programs that I mentioned to encourage the creation of digital academies and develop model courses to make it easier for member states to implement some of these things in a consistent way across the Union. Promote e-health and digital tools at the local level. Upscale and effectively integrate digital competencies into education and training programs. Fully incorporate IT solutions into existing care pathways. We've seen a welcome increase in this during the COVID pandemic, but we would like to see this continue in a more generalized way. Invest in education and the benefits of digital health. And finally, commission a European study to scientifically assess the value of digital solutions for patient safety and financial sustainability. Next slide, please. Then on the more soft skills side, communications, we recommend integrating patient participation communication skills into professional training, embracing communication skills that encourage patients' informed engagement in co-designing their own treatments, training patients, not just the healthcare workforce, but patients to recognize and help combat disinformation, help prevent the spread of disinformation and prevent them from making bad decisions on the basis of disinformation, to develop model courses as a guidance, to promote conceptual thinking and experimental learning, and to promote foreign language skills, particularly English, because many of the latest healthcare. Somebody, could you please go on mute? And promoting foreign language skills, because many of the best new research in healthcare comes out first in English, and that would make it more accessible to people quickly if they had the skills to read that in real time. Then the next slide is interdisciplinary recommendations, including a focus on adaptability. The MEP mentioned this also at the beginning, that we need to have people who are adaptable between skills, between regions and countries, even in the case of a pandemic. We need to have a better train the trainer program working across the Union in a consistent way, to widely apply the simulation training method, to provide possibilities for interdisciplinary education and training, to provide certified training on interdisciplinary management skills, to increase mental health literacy of the health workforce, because we know that that has been a big problem during the pandemic as well, and to educate in the spirit of the One Health principle. And finally, sustainability. We mentioned before, green is one of the greening the EU is one of the chief priorities of the European Commission. So we would like to recommend promoting existing good practices on green procurement and green implementation at the healthcare level, raising awareness of green skills, and increasing the climate health literacy of the healthcare workforce. And without further ado, I would pass the microphone to our panelists, beginning with Maya Matthews from the Commission, to talk about what their priorities are and how this report hopefully nicely feeds into those priorities.
Thank you very much, and good morning, everyone. It's difficult to follow on from the inspirational speech by the honourable member, and also this really wonderful summary of this report. I've had a chance to quickly look at the report. I haven't looked at it in depth, but I can say that it's very rich and very useful, because I think one of the amazing bits about it is the fact that it's really taken on board so many different so many different points of view, and as you said earlier, really from the ground. For us in the European Commission, this is absolutely vital to really hear from the practitioners, from the people who are experiencing health service delivery challenges, from the health professionals themselves. And I see many of you in the audience we've met before. Before I go into my speech, I wanted to also just mention that I think that this report is also very relevant, and you might have seen or heard President von der Leyen's State of the Union speech, where she announced the proposal that she will be making for Europe 2023 to be the year of skills. So I think that this report is really very, very timely, and I can tell you that I promise that I will also take my responsibility in disseminating it widely to our within the institutions and also to our partners. So thank you very much. You can start the slides now, please. I wanted to start with I can't see the slides. Are there? Can you see the slides? Yeah. Okay, great. So the first slide, I wanted to start my presentation with a bit zooming back and basically looking at the context we're in, the landscape that we're in today. I'm doing this by a project report that we drafted in the Commission called The State of Health in the EU. This is a 2-year kind of cycle. We work very closely with the OECD and the Observatory on Health Systems and Policies, and we produce different deliverables. We produce individual country health profiles, and we produce a report called Health at a Glance, which puts together all different data, very well reliable, well researched and evidence-based data looking at the state of health in the EU. And that report will be available, the next report will be available at the end of 2022. And I should say also that that report that we're expecting will have a focus. Normally we have 2 thematic chapters, and this year's thematic chapters, one will be the impact of the COVID pandemic on non-COVID care, because as I think you all see, it's also very important to look at the effects that the pandemic has had, not only on COVID itself and the pandemic, but the knock-on effects in other types of care for chronic diseases, for example. And the second thematic chapter will be on child and youth health, including mental health. So we're very much looking forward to this report. So I wanted to start by just saying that as part of this data gathering exercise, in the Commission, we produced kind of an analytical report that we call the companion report, where we highlighted 3 key takeaways. No, please go back. Yeah, 3 key takeaways from the state of health, if you like. One of them is, as I alluded to earlier, that we still need to understand better the far-reaching health impacts of the COVID-19 pandemic. And here I'm talking about the effects that the virus has had on individuals. We're hearing a lot more about side effects, ongoing, lingering problems. Also, as I alluded to, the mental health effects that people have experienced, and of course how the health systems are coping. So I think that this is it's a very wide takeaway, but I think it's important that we don't lose sight of the fact that COVID has really shaken our society, but also has really shaken health systems. The second takeaway, and it's already been mentioned a little bit in your report, is looking at the advantages actually that the digital innovation in healthcare delivery and public health has had. The pandemic served as a catalyst or an accelerator to really put in place many digital health innovations, which we had in place, but had not really been rolled out at scale. And here there's a very good link in the report about the importance of also digital skills and making sure that the health workforce have the skills necessary to provide this new type of healthcare delivery modes. And then the third takeaway, and the reason I'm showing this slide, is that of course we saw the real effect that the pandemic has had on the health workforce. We already knew beforehand. Let's be honest here. We knew that there were already health care shortages. We knew that the health workforce was aging in the EU and needed to be replenished. But I think that the pandemic has just brought this much more into stark reality, and we need to really think very carefully now about what we're going to do, how we're going to encourage more young people to take up these professions, but also, as you rightly say, what are the skills that are needed? And as I always say, that the health workforce is the cornerstone of a health system. You can have beautiful equipment, you can have excellent beds and wonderful care pathways, but if you don't have anyone to manage those and to be to be the face at every step of your illness, it's all for nothing. Next slide, please. And so these are the key takeaways, but let's also look at the reality of the situation. And as the honourable member said, we have a very, very mixed situation in Europe today. And I think this slide is a very good, a visual of what we're seeing in Europe today, that there actually is no standard pattern. Every country has full sovereignty and responsibility for their health systems and their health workforce. And as a result, you have very different pictures emerging. And this slide just shows you, it just says it's the ratio of doctors to nurses across Europe. And so in the top right quadrant is where you have high number of doctors, high number of nurses, and you'll see the rest is the different ratios. And what can you get from this slide? I would say the only thing you can really take from this slide is that there is no single pattern, and we have to this is our starting point, that every health system is very different, and that includes the numbers of health workers in the health system. Next slide, please. This is another way also of showing the same thing, which is that within the health workforce, we'll also see huge differences, disparities in the numbers in different areas. In this report that I mentioned to you, the companion report, we mentioned that 15 out of 27 countries mentioned that one of their key health challenges was health workforce shortages. And we can see that within the European Union, there's a huge range. The average, it's useful to have an average, but the average, you don't really see underlying that the huge disparities. And in some cases, especially for nurses, you can have a there's a factor of 4 in the difference of nurses across the union. Added to that, we've put this map because it's also not just by country. You have huge differences within countries, and we're seeing very much an urban-rural divide, that you have a lot more health workforce in urban and especially urban attractive areas compared to rural areas. So this is it's coined that the word that's used is medical deserts, but this is also a very important issue that really needs to be addressed. Next slide, please. And then this is my final visual, and then I'll get to what we're doing. But I thought it was important to show a little bit the landscape that we're in. And here, this is quite a complicated slide, but I think it's quite useful because it really shows you that this is about training. And you've seen that the top half is doctors training, and there has been an increase in doctors training over the years. It's small, but there is an increase. And the lower one is nurses. And again, here you see huge disparities between the numbers of nursing graduates through the years and between countries. So in a nutshell, from this report, we basically concluded that we need to do better workforce planning. And this is probably something that, because the other thing, of course, that was mentioned earlier is that as the EU, as the European Commission, we are very, very mindful of the fact that, we have very little competence in this area. So our added value has to be in projects and in actions that will help the member states, that will strengthen the member states, to address these challenges. So one area is possibly, data, definitely data, creating more data, also trying to come together to look at workforce planning, methodologies, how do you plan your workforce? The second thing is definitely increasing investment in training and education, and I'll talk a little bit about that. And then finally, very exciting in a way, is this idea about looking at, you know, the new skills that are needed, the skill mixes that are needed, innovations in healthcare delivery. How does that translate for the health workforce? And that's something that we can definitely work on with, you know, sharing best practices. So my final slide is a little summary of some of the work that we're doing to date, that we're supporting member states and stakeholders such as yourselves in this area of the health workforce. The first one is a project under the old health program, which really focuses on this area that I mentioned, medical deserts, also looking at task shifting, which is an important issue now, about looking at what are the traditional tasks and is there a way, you know, to mix them? Do we need new types of professionals? And then, of course, the huge issue of workforce retention, because as you rightly said, you know, what is the point of training, very expensive training, if we only find, which we are finding, and again, we don't have EU-wide data on this, but anecdotal data is telling us that a lot of health workforce professionals are actually leaving just a few years after they start their professional work lives. So we need to figure out why that's happening. So these are 5 projects that are ongoing, and they also have a kind of a website on the health policy platform. So it'd be good also if you, and I'm sure you have had some interchanges with these projects. The second one is very much talking to the issues about data. Data gaps it's a huge issue. In the EU, at European level, we still do not actually have a member state breakdown of the age of the different age breakdowns of nurses in the EU. We have that for doctors. Eurostat collects that through member states, but we do not have that information because it is not collected. It's not collected at the EU level by member states. So this is a huge area, but again, we have to be very mindful of not overburdening member states with having to collect lots and lots of data. But these are big challenges, and challenges that we will not be able to move forward without having better data on the workforce situation. And then the Pact for Skills Health Partnership, which I think you'll be discussing a bit later on with the Be Well project. We are very happy that the Be Well project has been chosen for Erasmus Plus funding, so that hopefully we will be able to now have the first health partnership as part of the Pact for Skills. And I think this is it's a very, very important milestone. And I hope that part of this will be to start the beginnings of a strategy, because I think a strategy cannot happen in isolation in Brussels. It needs to be a strategy that is worked on across Europe at regional and at national level, because as I said, that is where the training happens, that is where the action happens. And then on the continuous professional training, absolutely, we did a lot of outreach to different professional associations, and we found that this was the one area that was mentioned again and again where there wasn't enough funding. So we've launched a call for proposals, which closed a few months ago and is currently being evaluated to support different health organizations in providing professional continuous training across Europe, with an emphasis on digital skills. And then finally, I just wanted to also mention other funding sources, because most of these are from the EU for Health program. But I think it's also very important to raise the country-specific funding that the EU is providing to member states. So start with the big one, the Recovery and Resilience Facility. This is this new next generation EU money, over 700 billion euros to member states to recover and build back from the pandemic. And we have seen seen now out of the 26 plans that have been adopted, all of the plans have a health component, which we're very happy about. But within those plans, several member states have also focused on training of the health workforce. And I can just name a few off the top of my head: Italy, Austria, and Netherlands, for example, are looking at a specific, health workforce training. But there's also the cohesion policy funds, and here those are currently going through negotiations with the managing authorities, and there's a lot of scope there also for training of health professionals. And in my unit, we see a lot of the proposals that are coming through, and health is there, but it could be a little bit more accented. So if anyone is out there, if you have contacts to your regional managing authorities, it's also good to remember that the cohesion policy funds also provide an opportunity to invest in training. And finally, I would also mention DG Reform's technical support instrument, which is an instrument which provides technical and capacity building at country level. And last year, they launched a digital skills flagship, looking at the digital transformation of health systems. And there again, there's the possibility to really work at a country and regional level to improve digital skills. So I will stop there, but I look forward to staying and being part of the questions and answers. Thank you very much.
Thank you very much, Maya. And we would now pass to a panel on ensuring skills for the future within the health workforce, the Be Well and the UVECA projects, starting with Sabina Pasch-Olsen. I've skipped ahead with Dorota Tomalak from the Committee of the Regions. Sorry.
And there I was hoping I was off the hook for a second.
Not so easy.
Well, didn't work out this way. Thank you very much, Brendan. Obviously, always difficult to come after such excellent speakers as you've had before. But I'll try to be as quick as possible and give you just some of the regional flavor if you want. I work for the European Committee of the Regions. For those of you who are less familiar with the name, we're an EU institution bringing together local politicians. So in plain English, it's your mayor, it's your local councillor, your region's governor. These are the people who are coming to Brussels a few times a year to discuss all projects of EU laws that will be implemented at the local or regional level. And that's the majority of EU laws, if I may say so. Health is obviously included. So I was actually pretty intrigued when I got the copy of the report from Annette. Started reading it, I realized just how much it resonates with our own policy ideas and recommendations. You've heard from Brandon what the report is about, so I will not summarize it for you, but I'll just pick some bits and pieces that actually struck me when I was reading it. So for me, I think the starting point is something that Maya was also highlighting, the situation of the workforce. We've had some good news reading the previous Health at a Glance report, for instance, when we were looking at the change in terms of a number of doctors and nurses from 2008 to 2018. Within that decade, we saw some increase in numbers. So, hey, some good news. But of course, the last week's report from WHO that was circulated by Politico under the telling title Graying Gone, and unfortunately, it's not referencing the TV series The Grey's Anatomy, but the color of practitioners' hair. This report brought some less good news. As you saw, the number of doctors in Italy, 2/3 are over 55. You take Latvia and 8 more member states, you're over 50. So we're looking at the next 5 to 10 years, where essentially almost a half of the cohort disappears. The situation for the nurses is equally alarming. You take the Baltic republics, Denmark, Sweden, Czechia, I don't know how to pronounce the word. It's always complicated, but I mean, the situation is actually quite alarming there. So this is something that our members, the local politicians, talk a lot about. It's about making sure you actually find a doctor when you're senior professional retires in your rural community. It's about having your hospital run without rescheduling all surgeries because you don't have the anesthetist on call, or because your OP nurse is going into early retirement. So this is coming very often in the discussions we're having here in Brussels, and members are increasingly worried that it's simply not possible to replace such a cohort with business as usual. So indeed, training, retraining, upskilling, and task shifting may well be the only solution to this problem. So let me just quickly run through some of the skills that we saw on Brandon's slides. I think the digital is the one where massive progress occurred in the last 2 years. I mean, remember how it was before COVID, and suddenly overnight, we saw thousands of doctors switching to telemedicine to ensure continuity of care. We suddenly were able to book our appointments online. We could receive the results of our swabs per SMS or generate our COVID certificates online. So the digital arrived, and I very much believe it's here to stay. But the way how people embrace the skills, there is still some work to be done. But it's not really just about ability to use your computer or your smartphone. It's also about the infrastructure that would enable you to do so. You remember last year's Commission communication on long-term vision for rural areas. Only about 60% of rural households in the EU have access to high-speed internet, 60%. And only 48% of residents of rural areas believe to have basic digital skills. So this is a huge challenge for our rural politicians, for the rural communities, to have that infrastructure and then to have people confidently using it. Now, looking at communication, I think this is also one area where huge challenges lie ahead. You saw the pandemic. I mean, it was accompanied by another infodemic, to quote WHO again. And people faced with such an overload of information and some pretty blatant lies circulating through social media, they were not turning to the ECDC for information or consulting videos from WHO to get their answers. They were talking to their local GP, to their pediatrician, to the community nurse, or even pharmacists to get the answers straight. So actually, our mayors, our presidents very rapidly saw that if they want to succeed in the rollout of vaccination campaigns, they need to have the health professionals on board, and not just as instrument, as those who will be injecting stuff into your arm, but those who will be influencing the decision. And very often it was the personal conviction of the local GP that made or broke the decision. Am I getting a job or not? So here the communication, and it's not the communication to the patient, it's communication with the patient that makes a huge difference. Now, on the collaboration skills, I found this one probably even more challenging. And I'm saying that probably because I'm a civil servant. And in civil service, we have the same sin, I think, as in medicine. We don't talk to our colleagues. I don't talk quite enough to colleagues from interpretation, logistics, transport, or even other thematic commissions here at the COR. And I think the same happens a lot in medical field as well. The specialist doctor would not talk to the nurse. The OB-GYN will not consult the laryngologist. So people just stay in their silos, and breaking the silos and creating flexible teams working around the patient without that 19th century hierarchy going on. This is real problem, and I think this is where it takes more than just a new training course. It takes the whole change of a paradigm to happen. Now, the green skills, I think it's the most complicated for us to look at. But when I was reflecting on it, I thought, okay, well, for us at this year, it's really more about One Health. It's about making sure that it's not just a doctor prescribing you a round of antibiotics. It's about the food you're getting. It's about the agriculture we want to have in Europe. So I was looking at our positions, for instance, around the organic farming, intensive agricultural techniques, etc. So this is where I think massive gains can be made. And this is where we should be really focusing on medicated feed and moving away from these techniques. So in a way of conclusion, I think the momentum that we will have next year during the European Year of Skill is something that we definitely need to use to get that message across. The skills in a medical health force are there. The question is really how to accompany the workers in their acquisition of new skills, and also how to create a context where getting new skills or working differently is welcome and enabled. And I think in any of these endeavors, you will need your local mayors, you will need your regional presidents. It's where practice happen, and it's where the daily management is taking place and where it's being funded. So I very much welcome your report. We will be looking at it with our members in our political discussions. And I also very much call on you to keep involving your politicians because you will need them to succeed. Thank you.
Thank you very much, Dorota. And now we will pass to Sabina Pasch-Olsen from UVECA.
Yes, I will just try and share my slides. Can you see them?
Yes.
Can you see my slides? Yes. All right. So hello everyone, my name is Sabine and I am one of two project leaders working with UVECA. I work in Denmark at a hospital, so I can really relate to many of the things we heard previously in the previous speeches. UVECA is short for European Platform for Vocational Excellence in Healthcare, and it is designed to support the needed innovation and development of the healthcare sector by ensuring the provision of future-oriented skills within the sector. The sustainability of the European healthcare sector is challenged by 6 megatrends, as we also heard before, and as a consequence, the healthcare sector has for several years been undergoing major changes, becoming increasingly digitalized, streamlined, and focused on more staff and patient involvement and patient responsibility in order to gain maximum quality in care, patient safety, efficacy, and at the same time stay economically sustainable. The rapid development puts a heavy demand on healthcare professionals and students to adapt their learning and competence development into competencies and skills, which are not only related to traditional care and cure skills, but increasingly related to, for example, digital skills, communication and collaboration skills, multidisciplinary understanding, innovation awareness, coaching of patients to become empowered and improve their health literacy. All these skills are part of...
Sorry to interrupt you. Your slides aren't moving.
Aren't moving? Oh,
they're not moving.
We just see the first slide. I think you need to go into presentation mode.
Yeah, no. Did I stop sharing?
Yes.
Yes. Okay. So this is what we are talking about, digital skills, right?
But we actually had them, so we can share them if you want.
Yes,
if you want to share them.
Just share them. It's okay.
Can you please share again?
Perfect. So all these skills I just mentioned are a part of the so-called 21st century skills, which are important for the professionals to sustain a good career and keep the healthcare sector sustainable through innovation and development. UVECA will be implemented by a multidisciplinary consortium with 19 partners from 7 countries and consist of professionals, academics, local and regional health authorities, regional development agencies, and social partners. Within 8 work packages, the partners and their regional stakeholders will co-create a governance model as well as a concrete education and training activities for the 7 regional hubs and the European platform. And this one will then be developed, tested, fine-tuned, and made sustainable for uptake of regional partnerships beyond the partnerships. This is what we hope for. The project creates regional vocational excellence hubs in 7 European regions, which collaborate within one common European platform. And the objective is then to ensure coordination, adaptation, innovation, and upward governance within regional health education ecosystem, as well as promoting European blended mobility and interregional learning among healthcare professionals and students from the participating regions. Next slide, please. So the objectives for our project are within the collaboration through a European platform to increase the quality and attractiveness of vocational training and lifelong learning, and to contribute to implementation of the European skills agenda by ensuring continuity and high quality vocational education and training and lifelong skills. Also, we would like to contribute to implementation of the European education area and to create this sustainability of the European healthcare system. The participating regions are already involved in the work of the European Connected Health Alliance, the ECH Alliance, which is one of the pan-European partners in the project. The EHMA Alliance has for many years promoted the concept of health ecosystems to support innovation. And what we are trying to do is to connect this vocational excellence learning to the educational and research area. So we want to change so that skills development on all EQF levels in the healthcare sector becomes an important as all the factors mentioned in the model in order to ensure sustainability of the healthcare sector. Please, next slide. And these are some of the elements we're trying to create as a workflow for this project. We already started with a partner meeting in Denmark in the beginning of June. So right now we are about to set the scene. We are trying to gather input to a regional skills needs analysis to define what gaps do the students and the healthcare professionals experience in their daily workflow, and to figure out what skills we need to improve and what activities are already tested to enhance that. So based on the input from this first part, which was setting the scene, we will design and create this European platform, and we will also create the 7 European regional hubs. Within these hubs and placing on the European platform, we will develop these learning activities, which we will test with 100 healthcare professionals and students in each participating region. So, and based on the observations and material gathered in the testing phase, the ECH Alliance will, in close collaboration with all partners, be responsible for the presentation of good practice examples and present the sustainability and business plan for the European platform and describe policy recommendations which can serve as inputs to the application of the European Skills Pact. EHMA is also a partner within this project, and they will have the overall responsibility for dissemination strategy for the project, including a plan for uptake of new regions to participate on the European platform. And then in 4 years, we hopefully reached our goals and created a sustainable platform for vocational excellence and lifelong learning. So next slide, please. So as we already heard, there are quite good examples in your report. which also align with our project. I think communication and digital skills is also something we are really looking into and trying to enhance. Right now, as a part, we are trying to define the 21st century skills, and they are very broad. So this makes it really challenging for us to find relevant evidence we can use for our project. So our project relates to several of the recommended skills, and we hope that they combine they relate really good to our project, because we have the same issues we are trying to work with and to improve for the future. So next slide, please. I think I'm done. Yes, thank you very much.
Thank you very much. And without further ado, I would pass the microphone to Annette Rusinoff from the European Health Management Association to talk to us about the BWEL program.
Thank you very much, Brandon. Indeed, as Maya Matthews from the European Commission, DG Sante, already introduced BWEL as a kind of landmark project. This is what I would like to talk about, but it's true that we have received co-funding from the Erasmus Plus of the European Union, but I would rather talk about this as a movement. Rather than an EU-funded project, which has a beginning and an end date. And by the way, the beginning doesn't go back to a long past, because we kicked off the project in July 2022 only. So what I would like to summarize here is what BWEL does for the sector in 4 main points. Certainly a lot more, but due to time constraints, I will just focus on these 4 main points. First is gathering skills intelligence and creating a skills monitoring tool, because we do not want to simply respond to the skills needs now in the moment of time, but we also want to anticipate skills and challenges for the future, and also emerging professions, occupations, and their skills needs. Second is BWEL will launch the first ever upskilling and reskilling strategy for health workforce for the sector, and it's in the context of green and digital transition. This will entail a large scale inclusive consultation process in different rounds. The first version of the strategy will be launched in mid-2023, and then it will be refined and enriched by receiving different inputs from consultation, from testing, piloting, educational curricula, and training programs. And then we will launch the final version of the strategy in mid-2026. So the third point is these educational programs and training, education and training programs in the course of 2024-2025. These courses will be open, accessible, and free of charge for any interested students and people, professionals on the job. So this is an engagement activity with us, with BWEL. So follow us if you are interested in such an educational course or training activity. And the fourth point is in parallel with these 3, we will also launch a Pact for Skills partnership, as Maya also mentioned, for the health ecosystem. The Pact for Skills is a shared engagement model between multiple stakeholders for improving skills. And this is one of the action areas of the European Skills Agenda 2020. The European industrial strategy identified 14 industrial ecosystems, and the idea is that at least one skills partnership is set up in each of the 14 industrial ecosystems. For the health ecosystem, this skills partnership will be the first one, as Maya also said. The European care strategy that was published 2 weeks ago, I think, they talk about already a long-term care partnership, so that will be the second one, but that will take still time. So the Pact for Skills offers 3 types of services. One is networking. Yesterday we had, for instance, a networking event for Pact for stakeholders interested in Pact for Skills partnerships who are not yet members. Knowledge hub, so that will be exchange of good practices and capacity building. And the third is resources and guidance, so providing information about funding opportunities, as also Maya did now. And yesterday, indeed, this is what we also did. We raised awareness about funding opportunity. So Be Well will facilitate the setting up and launching of this partnership. We will do already preparatory activities this year. So before the end of this year, we will launch this partnership and we will roll out the services as of 2023. So this is the second engagement activity with us. Interested local regional partnerships and individual organizations, those who are committed to upskilling and reskilling, can join us. And it is open up for any partnership or any individual organization. And they can submit commitments through a particular form. So who are behind this movement? Currently, we have 24 full partners and 5 associated partners in the Be Well consortium. So this will be, and this is the basic partnership, and this is where we will invite external stakeholders to join. You can see from these logos that we have in our consortium healthcare provider, training providers, higher educational institutions, networks, associations representing health professionals, doctors, nurses, specialist nurses, pharmacists. We have industry, we have social partners with us, and organizations or partnerships with a similar profile will be mostly welcome to join us and complement our efforts. Referring back to the EUHPP report, we are in full agreement with the 4 clusters of essential skills that this report has identified. Digital skills, we've talked about it a lot, and the previous speakers as well. There's not much to add. The ongoing digitalization and of the sector is obvious, and without any doubt, further digital tools and data-driven services will follow. That and their proper and large-scale adoption does need and will need new skills. We also confirm that more should be done to raise awareness about green skills, because we have the impression that for the moment it does not receive yet as strong highlights as green skills, but most probably it will change over time. And these 2 main clusters of skills are necessarily complemented by soft skills, communication skills, and interdisciplinary skills, which are crucial. BWell also agrees with the challenges that are listed in the report. We have to be mindful that when we start these upskilling and reskilling movement and we fix these objectives, we are maneuvering in a context of shrinking number of aging and exhausted health workforce. So we have to be mindful of these conditions, of this framework. This is why we believe in BWell that an open, inclusive and large-scale dialogue with a wide range of stakeholders, particularly organizations, networks, associations, representing health professionals, their social partner representatives, are a must. And this and mapping the needs, motivations and ambitions should be met first, and only then can we adequately and appropriately address these needs.
Thank you very much, Annette. And now I would pass the microphone to my colleague, George Valiotis from EHMA to moderate the first part of the discussion. We're running a little bit behind schedule, but not to worry. I don't need 15 minutes for closing remarks. There'll be plenty of time for your questions as well.
Thanks very much, Brandon, and thank you to all the speakers who have painted a terrific picture. We have a very clear idea of the huge diversity of issues that are happening in the workforce. So I'm the Executive Director of the European Health Management Association, and we're a partner with Health First Europe in this work for many years, in fact. So today's report that we're launching really reflects several years of work. And I can hear someone's microphone active. Thank you. So today's report reflects work of many years, and it reflects your voices too. I see a lot of people in the audience who have fed into the report, and so I feel like everyone in this room will largely be on the same page. But I also, maybe you share in my experience, which is it's a lot of stuff. It's a lot of information. So how do we focus? And so now I'd like to invite back Maya and Dorota, who've already given us great speeches. And I want to just dig in a bit more into some of the information you presented. And my first question for you is, out of the many recommendations, which priorities and policy directions would you recommend us to focus on? I know that's an overly simplistic question and we have to do a lot, but where do you think we should be focusing? Maybe I'll start with Maya, if that's okay.
Thank you, George. I think it's a good question. I think it also depends when you say, where should we be focusing? Because if you mean like yourselves, European Health Management Association, I would say a different answer. I think I would say for me, one of the key issues that comes through in your report and the call to action, but maybe not quite enough, is this call for better data. Because I think without actually measuring and knowing what's going on, we're really at the moment relying on anecdotal evidence. We need to see, that's why I took the time to show those slides, because I think it's only by really seeing what's happening in the whole of Europe that we can really, get member states to act a bit faster. So I would say that the call to action on data is very important. And the other one that I thought was also very important was this about the training and education, that I don't know how much training and education has changed over the years. Again, it's anecdotal, but how much of the training actually is, taking into account the new digital delivery, bearing in mind, and this is also something I meant to say, we have to be very clear that when we talk about training for digital skills, it shouldn't be burdening the health workforce more. It shouldn't be adding to already the lot of work that they have. It should be facilitating their work. And I think that's also key, that there has to be a lot more focus on what kind of digital training is useful, and also what kind of digital healthcare delivery is important. We haven't really evaluated everything that's happened in the last 2 years in terms of telemedicine, and some of it is certainly good, but we're already seeing a lot of countries are going back to face-to-face, and telemedicine is being shelved. So there's a lot going on there, as you said, but I would say for me it's the digital skills training and the data would be very important.
Yes, indeed, because we don't even know if that shift back to face-to-face is what patients are asking for, what the balance is. Yeah, that's a very good point. Okay, so more data, more research. Dorota, if I turn to you, obviously you have a different perspective, and it really stood out to me the way you talked about the unique role of the mayors and the other decision makers locally. So from that perspective, what do you think are the policy priorities that we could be focusing on?
The answer I was planning to give you before Maya stole that idea was to focus on data, but I will still actually pick that answer, mainly because when COVID started, and we were all scrapping for answers. So, okay, well, how many beds do we have? How many doctors, pulmonologists we have? How many nurses we could shift from one place to another? And suddenly we had members calling the members of the regional presidents, calling their capitals, calling Brussels, calling us. Do you know how many, beds we have here? And on the other side of the border, do you have data for them? And that was a realization for all of us that there was information available, but it was not up to date, and it was not at the level we needed it to be. It was very interesting to see the slides that Maya was showing on the sort of regional differences in the density of health professionals, and this is something we see as a problem. We don't have this information, and we don't have enough information across borders. We barely touched upon the cross-border dimension of all of that. It's happening on the ground. We know that. So there is some random information. Okay, well, here Mecklenburg-Vorpommern is working with Zachodniopomorskie, and here in Belgium you have Ostbelgien working closely with the German partners, but we don't have enough information, we don't have enough data, and that also makes decision making at local level difficult. And I think we also need to break with this obsession that everything can be done nationally or regionally. We need to work closer also with partners across borders. This is what we have the European Union for. And if you don't have the doctors on your side of the border, there's the other side of the border too. And I'm not saying that to encourage the brain drain and stealing of, educated people going from one country to another, because we know that's happening a lot. We know that's a problem for, let's say, Romania, for instance. But there is also a value in learning how things are done in this other place, 50 kilometers west, east, south, north, and bringing that knowledge back to your region, to your municipality. And I also wanted to mention, pick up on something else on the training, on education. It is indeed a national competence, but we also know that in quite a number of member states, the curricula are decided at the regional level. So there is also that regionalization in education. So also bringing the regional authorities may be interesting, because they will have essay also on the review on the update of existing curricula, which indeed may need to be revised. So that would be my second comment there. Thanks.
Okay, thank you for that addition, Dorota, and very interesting to hear more about cross-border care and cross-border collaborations, because now we're hearing about multidimensional, aren't we? That we need to be working locally and nationally, but also cross-border and comparatively. So so if I was to drill down to that a bit further, both yourself and Maya mentioned more data, and Maya, you spoke, you gave the example of telemedicine. Is there any data in particular that you think would be needed, that we could be focusing on? Maya, you also did mention the age of nurses. That's one data set missing. If I was to push you right now, can you think of other things that you think are missing in the knowledge space?
Yeah, I mean, I think that we were in my unit, we work very closely with Eurostat, and I want to take the opportunity here to say I think that they do a fantastic job, but just the nature of data, maybe not so much about what we need, but there's also a huge time lag. And we're finding that, I mean, and now Eurostat is able to produce very relatively quick data about excess mortality. But most of our other indicators for health status and also health systems is usually there's a time lag of 2 years. So I think we should also embrace the new digital technologies to also try to get data more quickly. And here, I guess I can do a plug for the European Health Data Space proposal, which is currently going through negotiations, where again, it's a very innovative proposal from the European Commission to create the first of its kind health data space, which would basically connect all member states with anonymized data. So it's got two parts to it. The primary data would be for patients to be able to have their own medical records available to them at all times and be able to travel with them cross-border. But the second part is about secondary data, and that could really revolutionize the amount of data and information that we have on our fingertips.
And so what would that mean then for people in the room? So those new data sets would help us to do our own planning more effectively and to be pitching for or proposing other work streams, which I'll come back to ask another question on, but I'll just, Dorota, come back to you. Do you have anything else that you'd suggest in terms of either data or any other evidence that you believe is missing?
From our perspective, is getting any data at the regional level that is not 10 years old, because national data there is this 2-year delay. But if you look at the regionalized data, which are not collected so routinely, it often happens then you would have them, but they would be from the previous ad hoc poll that was happening 10 years ago. But actually, I think what Maya was saying, the data, European health data space, I think this indeed, if that happens, and it's a big when that happens, hopefully next decade or so, this is what the citizens were asking for. This is what the COR was asking for in the the conference on the future of Europe too. Because I mean, it is in a way crazy that we can, with our driving license, we can rent a car everywhere in Europe, we can withdraw money everywhere we want, but we still cannot take our medical results with us when we travel on holidays. It's somewhere crazy what Istvan was mentioning about going into 3 different hospitals, 2 different countries with his son. This is still the reality that we don't even have e-prescriptions running in Europe. And we cannot take the last image with us on the card if we go from one country to another. So this is really the direction to be taken.
Okay, interesting. So then in terms of other directions that we can take, you've heard today about the Be Well project and UVECA. You can see some of your other colleagues in the room, and obviously you're supporting these initiatives already. And I wonder, where else do you think that you as a policymaker or you as leaders could support our initiatives?
Well, I think that, as I said, I think the report is very aligned to some of the things that we're already doing, and a lot of it is just starting. So I think that we need to. I'm a big one. I'm in favor of sustainability. I also wanted to mention that in terms of data collection, I'm not a big fan of doing one-off projects where there's a lot of data that's collected and then it just, it's relevant for a year and then it's forgotten about. So part of the projects that we're trying to support, and that's why this joint action that I mentioned, where we're trying to really work with the member states to try to embed things in their policy planning. I think for me, that's the most important thing, that this is a structural issue. There's not going to be any quick fix. And as you said, it's multidisciplinary as well. It's a lot about, if we want to go really philosophical, it's a lot about this generation, the Gen Z or whatever they call it, what they're looking for in their lives, what are their aspirations, what are their horizons, and maybe the job, the job of a doctor and nurse is not what they see, themselves doing. We have to really think much broader, I think, than just trying to find quick fixes. So I think that the whole health area has come into the fore, and so we're putting attention on it, but we also, in terms of skills and professions, it's a much wider discussion as well.
Thank you, Maya. Dorota, you, again, I've already pointed to the unique ways that your agency works and the voices that you represent. Is there anything else that we can think about of how your agency can support the work that's happening?
There's definitely a lot of a big field where change may occur in terms of changing this paradigm that I was mentioning earlier. I think we see still a lot of this stratification, that you have a specialist, you have a generalist, and then you have a nurse, and then you have the orderly. These silos, but also the strict hierarchy is still happening. And then how would you attract young people to a profession of a nurse if they think, okay, well, another year of study and I can be a doctor and my salary can get another 0, or I would get more recognition socially if I'm a surgeon rather than being just a local GP in my rural community. So there is a whole, I think, a change that need to occur in valorizing all medical professions, not just focusing on the top specialists, which we very much need. But this is just the peak of an iceberg, and we need to have that broad base as well. And that comes with changing attitudes. It's making sure that all contributions are valid, that in these teams there is no clear leader, that the leaders are changing when the need occurs. And it's also about making sure that people get the chance to try on new roles. So why should it always be, I don't know, a nurse doing a swab, or can't a midwife do vaccination as well, etc. So people get to try on new shoes and maybe see, okay, well, I've done this part for a few years. Now I would like to get a shortcut to try something else. And here I think creating that context, that comprehension at the local regional level, this is possible. And I think this is especially key for our rural areas that do suffer from this medical desertification, where recruitment and retention is particularly complicated. This is where this change needs to occur. And I think this is where our mayors, our councillors have the biggest role to play in making sure that, okay, well, this is not your typical workplace. This is where you will get a chance to try new things. We will pay for your training. We will give you that opportunity to do something else if you want to stay with us.
Very helpful. Thank you both. Just to finish up before I hand back to Brandon, I've got a last question for Annette well, actually, for a question for Biwal and Uveka, which is, how can these projects, thinking of the recommendations that have come out in the report today, and I've seen a lot of people in the chat asking if this recording will be made public and the slides, but I also think, as you ask for those things, the report actually has all this information in there. Like, the report is the place to go. It's all contained and it's very well written. So thinking of that report, Annette and Sabine, thanks for coming back. How can the project activities of Be Well and of Uveka support the recommendations? Annette,
can I go
yes,
first? Yeah. George, I think that there is a clear alignment. Be Well launching the Pact for Skills partnership for a health ecosystem. The EOHPP report having a number of calls to action, recommendations, which are, as I said, we are fully in agreement with the four clusters of skills, with the challenges. So the commitments that this partnership will accept could indeed accept actions, commitments to address these recommendations. So the partnership could be a platform to realize to implement these recommendations, and vice versa. I think we should have indeed a discussion with the Be Well Consortium and with the EUHPP member organizations, but there is already an overlap. So some of the Be Well Consortium partners are partners of the EUHPP network as well. How to shape the description, the concept of the health ecosystem partnership that also is aligned with the EUHPP report ambitions. So this is how I see the.
When you say the partnership, do you mean the Pact for Skills?
The Pact for Skills Health Ecosystem Partnership, indeed.
Yeah, okay.
Yeah,
so people can join that at the end of the year. I think you said you'd launch that.
We are launching it, and then commitments, most probably commitments, we will start collecting early or mid 23. Yeah, so this is where we will become more active and more organized. But discussions, of course, can start before. So we are open to just have a call, have a discussion, get an email, and start dialoguing. Yeah.
Okay, thanks, Annette. So look out for the Pact for Skills. And in the last minute, I'll turn to Sabine. Sabine, thanks for your great presentation. Anything else, any final comment about how UVECA can contribute to the recommendations of the report launched today?
But I think the UVECA project shows that what we are working with is in alignment with the recommendations and the call for actions that are written in the report. So I think it's great to see that we are now trying to figure out how can we enhance some of these recommendations or calls for action, and trying out to see, are there any recommendations we can create or figure out to to support the report, and to find out how we can minimize some of the gaps.
Great. Great, terrific. Thank you, Sabine, for your contribution. Maya and Dorota, really appreciate your fantastic contributions today, and thank you for joining us. Brandon, I hand back to you.
Yeah, so thank you very much. I see that we've got a couple of questions. I'm not sure who was first, Bert or Jennifer, but I saw Bert first, so I'm going to call on him to introduce himself first and then ask his question to the crowd. You're on mute, Bert. You're on mute, Bert. Still on mute, according to my screen. Did we lose him?
I think we lost him.
Yeah, no, I'm back now, I think. Yeah. Okay.
Excellent.
First of all, thanks, Health First Europe, for the new report, because I see in the report that the workforce is still in, and as representing an organization of the workforce in healthcare, it's very important that these points are coming back in the discussion. We knew that we were working 10, 15 years before the COVID crisis to announce the European Commission and everybody that there were problems in the healthcare, and they were working on. And I'm very, okay, you cannot be content with the COVID, but COVID was bringing us a new opportunity to bring health on the discussion on the highest level. And I see that 2 points are coming back in the discussion, and Mrs. Matthews make a reference to the workforce retention that Health First Europe and Eurofedop were making reports on that more than 10 years ago, because retention we have seen as one of the important points. I'm glad that this point will be also in the action. And for the Committee of the Regions, I see that the point of brain drain, what we are telling also for years, you see it best if you work on the local level, and you see it, of course, the Committee of Region can help there to do a lot of things on this brain drain. So there is an immoral problem with what happens in Romania, that so much doctors and nurses are going out of Romania. This kind of brain drain, we must try to stop it. And of course, there must be studies, there must be information, and I hear that for years that we must have it, and we will have it. The Commission is working on, but on the end, I'm thinking that action on brain drain and action on retention is necessary in a very short time. Thank you.
Thank you. I'm not sure if anybody would like to comment on that from among our panelists. So we could give you the microphone briefly. Otherwise, Jennifer has had her hand up for a while. Please introduce yourself as well before.
Hi, thank you for this wonderful event. My name is Jennifer McIntosh. I am a project director at a small and relatively new organization called the European Children's Hospitals Organization. Right now, we currently represent 13 children's hospitals across Europe with the intention to grow. I also co-chair our nursing working group. And the issue that the nursing working group has decided to focus on, and it's a relatively new group as well, we've been up and running for a little over a year, is workforce. And so I just wanted to first say that I completely agree. I'm looking forward to reading the report. I haven't had a chance to do that yet. I think a lot of what I've heard the panelists say here really reflects our needs, but I would take that down to a level of pediatrics, because what we find in pediatrics is, for example, the data that exists doesn't represent our needs. So for example, if you look at Eurostat, we can talk about hospital beds, but we don't know about pediatric hospital beds, and we definitely don't know about PICU beds. So if the COVID pandemic had really affected children, we wouldn't have known what our resources were to help deal with that pandemic, for example. In terms of workforce, it's the same thing. We had the International Year of the Nurse and Midwife, but a lot of those reports that came out, I was so excited. I looked at them, this is going to be great. And none of it related to our needs because it didn't get down into the issue of pediatrics. And the pathway, the education pathway to being a children's nurse in Europe is so different across our countries that it's really difficult for us to, even when you're talking about counting nurses, who is a nurse? What does she, mostly she, do? Is it a registered nurse? Is it an advanced practice nurse? Do you have nursing assistants in your country? Do you have pharmacy staff that support nurses on the floor? All of these things factor into, when we're counting nurses and workforce, it makes it very complex. So what we've done in our organization, we've done a small study trying to address some of this, we're in the process of analyzing it right now to get at some of these questions. So I feel like in general, though, when I see these, I think that's what they're called, the state of the health reports that come out, at a European level and country level, they just don't give us the data that we need to help address the issues of pediatrics and especially subspecialties at a hospital level. So I really agree with everything that I've heard today, but kind of wanted to just bring it down one more level to the specific needs of pediatrics. Another thing that I heard somebody mention was the value in learning of how things are done in different countries. That's something that I also hear from nurses in our working group, and we struggle with finding funding for they want to go and learn how a PICU is organized in a different country. And there's not really that kind of funding for just these exchanges. We've looked at the Erasmus Plus program. We've tried to finesse some proposals there that would allow us to do these exchanges, but really nurses want to send a group of people over to see how does this actually look like in practice. Nurses are there at the bedside and they want to see how it's done. And I support that. So I'm sorry, my husband is trying to call me. I didn't have my do not disturb on. So I think that's enough. Anyway, but I really thank you for this report. I look forward to reading it, and I just wanted to highlight the need of pediatrics.
Thank you very much for your comment. I mean, that actually goes to our first call, which was the need for data. So that it goes both at the high level as well as the more granular level. I don't see any other hands up at the moment. So I would ask one question related.
Brandon, sorry, can I just speak to Jennifer's comment?
Sure.
Jennifer, thank you so much for being here. And it's exactly by being in these meetings where we can get more aware and more connected on these topics. I first want to say that, I mean, this doesn't answer your question, but EHMA also did a report, an investigation into pediatric RSV, and we surveyed hospitals and primary care facilities all over Europe to try and get some data on what is going on with consumption of resources for pediatric RSV. So we shared that point with you, and pediatric care is on the agenda in that way for us. But to keep it on the agenda as well, I think it would be very important to have you connecting to the Pact for Skills, which Annette mentioned. That'll come from the through the Be Well project. So they're going to launch at the end of the year. Because as I was hearing you speak, I thought, yeah, really, actually, pediatric care is not properly understood in this work. And while you were talking, I also looked back at the report, and I could see, although we have endorsement from the Children's Hospital Coalition, we don't have enough content on pediatrics. And so to keep that going, apart from the Pact for Skills and you being here, I was also thinking of something else which has now slipped my mind, but let's stay in touch and make sure that the needs are better understood. So thanks for being here.
Well, thank you, and just we would love. I think I'm on. I would love to be able to find ways for us to continue to be involved. So please do, if there's a way to follow up with that, please let me know.
Actually, the other one I just remembered was the strategic plan that Be Well will develop. We'll also get that on the agenda to make sure we address the needs of pediatrics. So thanks again.
Great. If Naomi Hankinson is still on, she mentioned earlier that Kotek may have some of the missing data. If she's still on and wants to describe that briefly, that would be great.
Hello.
Yes.
Hi, I'm still here. Yes. Every year we collate a data set. In fact, I've just been listening and thinking perhaps we need to add some parameters to that about the age of the workforce. But we look at how many occupational therapists there are in each of the countries and where their specialities are, what the level of education is. It's quite a detailed report, and certainly I know our members find it very useful to sort of work with each other on that, but I'd be very happy to share some of that information. Obviously, it is about occupational therapists across the European countries. So yes, I'd be very happy to share that with whoever may find that interesting, either as a model or the information itself.
Thank you very much. I see two more hands up, so I'm just going to take them in order. Apologies for the pronunciation, but I believe it's Dr. Charalambos Dokos.
Yes, that's right. Hello. Greetings from Cologne. I don't see if you see me. I'm representing the Institute of Pharmacology from the University Clinic of Cologne. And I would like to share the experience of one of the largest health markets that's in Germany. And there is a lot to discuss about that. Actually, I find all the comments and proposals very exciting. I have to, starting from academic stuff and from the point of view as a doctor, surgeon, and experienced one, I have to say there is a lot of disparity between the universities. And I think the key is the medical education. And medical education through a digital transformation. We see also by young students, by people that they are in the generation of digitalization, that they are not so sufficient in these skills. I mean, if they start their career without these skills, they are at the end in a different way handicapped. They cannot move in their career. They cannot have all the options and all the resources that they have. You see them from the students. I work with medical students, which means that they are the future doctors. In 10, 50 years, they will be the future colleagues. Not all of them, but some of them. And you see also there is a lot of you see, there is a lot of way they don't easily understand that Germany is a big market, it's a big health market, but it's such as with Europe. The European integration, I think it's in other small countries you see them, but in Germany you don't see them. That's why there is a large disparity in guidelines, in what we called medical education, also between universities in the curriculum. There is a large of gaps, which is something very, from one point is exciting, from the other point is like a little bit discouraging. There has to be some rules about, and a little bit to come the students inside Europe. I think inside what's the European market is. That's my opinion.
Thank you very much for the comment. It's something we hear very often, is that we tend to focus on the discrepancies between the member states, but even within the member states and the regions within the member states, there's often these discrepancies that you're describing, which seems really kind of crazy. I think the next hand was Rodrigo Felipe.
Yes, hello. Thank you, everyone. My name is Rodrigo from the European Center for Disease Prevention and Control here in Stockholm, Sweden. Thank you so much for the invitation and for the great report, which I will read with very carefully.
Thank you.
I just brought.
You just froze on us, Rodrigo.
Can you hear me now?
Yeah, no, yes, now we hear you.
Maybe I will turn off my camera to optimize bandwidth, maybe no bumps. So I work in the public health training section. We offer field epidemiology training programs and continuous professional development opportunities to public health professionals working with infectious diseases. So this is a topic that we did not really touch so much upon today, but I see that it is in the report, the epidemiologist aspect of it, and very much the public health. And I just would like to mention that we will be in touch with a number of things, initiatives that have been put in place, and we do with our stakeholders a capacity and training needs assessment on a 3-year cycle. And I just like to say that I resonate a lot with the difficulty that many of the colleagues here said about collecting data, because there isn't sufficient data, and our contact points struggle to give us precise data that can be enabling and informing future projects, and this is a struggle. So whatever initiatives will be put in place, especially the sustainable ones, to keep indicators on that will be extremely helpful for us too. And one very interesting question that we have is, how many epidemiologists, because in our mandate of the ECDC says we need to help the member states to achieve a sufficient capacity. And we turn around to each other and say, what's sufficient? So how many epidemiologists do you need per 100,000 population to be considered to have a sufficient capacity? Nobody knows the answer to that question. And last week we were present in a global meeting of the field epidemiology programs in Panama. And this question was also raised. And the US CDC admitted that they come up with a number of 1 epidemiologist per 100 or 200,000 population as an urgent need to, justify some funding, but nobody really knows. And this is a little bit empirical knowledge. So there's a lot to be done there. And collecting data is the first step. But then the next question that will impose is, what's the right threshold? So how many nurses, how many doctors of this and that do we need? So that's going to be quite an interesting way ahead. And we are looking at it carefully from the infectious disease perspective. Thank you so much for today.
Thank you very much for your comment, and it's glad to hear that you found the report hit your issue. Next, I see with a hand up, Dr. Ellen Kuhlmann.
Thank you very much for organizing this really very important meeting and for giving me the opportunity to join you. I'm from the European Public Health Association, the Health Workforce Research section. And just a brief comment, in addition to the many important things that have been said, and I totally agree that we need more data for all. health professional groups and all carers. But at the same time, from my point of view, I think what is most urgently needed is a different approach, and an approach that takes greater attention to the team. So no longer having this hierarchical idea of we have different professional groups and we need more data for each of these groups, but also thinking more from the patient perspective, from the task perspective. And currently, at least to my knowledge, a team approach in health workforce development and management and governance is totally lacking. But COVID-19 told us really that we need this approach very urgently in order to be really efficient, in order to use resources efficiently. And a team approach means for me to improve the coordination and communication and collaboration between the different health professional groups. At the same time, it also means to use the resources more efficiently, to improve equality, to reduce all this hierarchy, to reduce gender inequality, and to reduce what is called all these racialized dimensions in the health workforce, which we all know exist. So that is just my comment, that I would find it very helpful in future also to think how we can improve these kind of things, and how we can improve really the more collaborative interdisciplinary style. Thank you very much.
Thank you very much for your comment and encouragement. I see we've got 5 minutes left on the clock. I think we'd have time for one more question if anybody has one. If not, I would just make a very short conclusion. Seeing no more hands, I would just give a huge thanks to all of our speakers and to all of the participants, and also to our host, MEP Istvan Weye, who I believe had to leave earlier, but his team is here still on the call. The slides and the recording will be shared with you afterwards. We'll send links to those. It was fantastic to hear from Maya how our report dovetails with the Commission's own priorities, including the plans for the European Year of Skills in 2023. We hope that we've given you some good ideas. Also, the European Health Data Space is not something we've dwelt on a lot, but it's clear that these two ideas fit very well together. Thank you to Dorota for talking about how upskilling and reskilling at the regional level, especially rural areas, may be the only short-term solution to the skills gaps on the ground. Thanks to Sabina and Annette for how their projects will build on the work that we've begun and others have begun before us and go beyond that. And we wish all of you the best of luck in those projects, and stand ready. I speak on behalf of George, I think, as well as Health First Europe, to say Health First Europe and EHMA will be glad to continue to support all of these projects with also the stakeholder network that contributed to this report. So thank you very much for your participation, your enthusiasm, and good luck for what comes next.